I chose to complete my final project on acquired apraxia of speech, and as I go throughout this video, I may refer to it as AAOS. And AAOS is a motor speech disorder that impairs a person's ability to plan and execute any motor movements needed for speech communication. A person with apraxia will have normal muscle strength and coordination, but cannot plan and organize the movements effectively. ALS is most commonly caused by traumatic brain injuries, strokes, or progressive diseases such as Alzheimer's disease and Parkinson's disease. AIOS may present differently case to case, but often patients or clients have issues with prosody and experience slower speech rates. They may lengthen phonemes because of these slower rates. They have articulation issues because they can't fully execute those movements properly. Often they try to self-correct because their comprehension systems remain intact. This may cause frustration because they're aware of their mistakes, and it may hinder their social relationships. Treatment for AAOS includes articulatory kinematic therapy as one approach. Articulatory kinematic approaches include immediate repetition, imitation, modeling, or integral stimulation. Some examples of this are a therapist may prompt by saying things like, listen to me, watch me, do what I do, things like that. Imitation and modeling used over time in a repetitive approach may effectively stimulate the patient's motor speech planning and implementation skills. Like most things, if a person is more exposed to a skill or technique, the better chance they have to retain and utilize it long term. It's important that therapists consider the environmental impacts that acquired apraxia of speech can have on a patient. It may become very difficult for a patient to keep up with social relationships due to the obstacles that come with unintelligible communication. Therefore, using a system such as picture boards to start in a therapy timeline may help a patient to communicate their basic needs effectively to begin. And the therapist may gradually incorporate new systems as the patient becomes more able and ready to do so. As therapists, we must take into account the feelings and the readiness of our clients to continue taking steps throughout their therapy timeline. It can be detrimental to a client if a therapist pushes a client too quickly and may negatively impact their confidence in themselves and the confidence in their therapist. That's never beneficial for any therapy situation and definitely hinders that client-therapist relationship as well. So in conclusion, with optimal knowledge of the causes, symptoms, effective treatment approaches, and the consideration of a client wholly in regards to acquired apraxia of speech, a therapist or clinician may drastically help improve communication for a patient or a client.